Hello, everyone. I am a health expert who once worked at the American Heart Association, AHA-ACC. We all know that age is like a book. The closer you get to the final pages, the more precious the words become and the more cherished each memory is. But there is a silent thing that often lurks between those pages. That is high blood pressure. People call it the silent killer. And believe me, it's no coincidence that doctors around the world use that term. I once met a patient. He was about 62 years old, healthy looking, walked every morning, and never thought he had any serious illness. Yet one afternoon, he suddenly collapsed due to a stroke. When we checked, it turned out his blood pressure had quietly been rising for many years without being detected. He told me after recovering, "If only I had listened to my body sooner." Have you ever felt like that? The body sends signals, but we ignore them because we think, "I'm fine, I don't need to worry yet." So today, I want to share with you 10 important points from the latest 2025 blood pressure guidelines of the American Heart Association, AHA-ACC. The first thing I want to emphasize, high blood pressure can happen to anyone, at any age. Many people think that only when they are 70 or 80 years old do they need to worry, but the truth is that the risk starts as early as 40. I once met a 55-year-old lady, petite in stature, who ate a strict diet, yet still had a blood pressure of 145/95. Blood pressure does not discriminate whether you are thin or fat, rich or poor, male or female. It is the silent knocking of time, and if we are careless, it will knock louder. The second thing, high blood pressure is not only related to the heart, it also affects the brain, memory, and even increases the risk of dementia. Imagine this. Our brain is like a garden, with each neuron being a small flower. When blood pressure is high, the blood vessels nourishing that garden are damaged, narrowed, and cracked. And then, each flower, each memory, each story, each familiar face can gradually fade away. I have witnessed many patients complain, "Doctor, lately I often forget the names of my loved ones." And behind that is uncontrolled high blood pressure. The third thing, blood pressure readings are not random numbers. Systolic, the top number, and diastolic, the bottom number, are like the heartbeat's knocking rhythm. The higher the number, the more your heart is working harder than necessary to pump blood to nourish your body. I often tell patients, don't see the blood pressure monitor as an enemy, but rather as a messenger. It tells you how hard your heart is struggling. The fourth point, lifestyle changes remain the most important foundation. Even if you take medication, diet, exercise, and rest are still the main keys. The 2025 guidelines still affirm that the DASH diet, low salt, lots of green vegetables, whole grains, is one of the best ways to keep blood pressure stable. I remember an uncle in his 60s who came to the clinic each time carrying a long list of medications. But when he decided to change his meals, gradually cutting out red meat, adding fish and vegetables, after just half a year, his blood pressure dropped significantly, and the doctor reduced his medication. He laughed and said, "It turns out I'm a better chef than a patient." Fifth thing, salt, the sweet enemy. I know, salty food is delicious, especially for us Vietnamese who love fish sauce and pickled vegetables. But for older Americans, potato chips, pizza, and canned foods are also full of salt. Did you know that just reducing 1 teaspoon of salt a day can significantly lower the risk of high blood pressure? Imagine, instead of sprinkling salt, you sprinkle some herbs. Tasty and good for the heart. The sixth thing, exercise regularly. No need to overexert, just be consistent. I'm not asking you to run a marathon. Just 30 minutes of walking each day or gentle yoga is enough for your heart to breathe easy. I once had a patient, a woman in her 70s who really hated the gym, but she loved roses. So every day she spent an hour tending her garden, and the result? Stable blood pressure, cheerful spirit. Seventh, stress is the fuel for high blood pressure. Have you ever felt stressed and then measured your blood pressure only to find it sky high? The new guidelines emphasize the importance of meditation and deep breathing. I often teach patients the 4-7-8 breathing exercise. Inhale for 4 seconds, hold for 7 seconds, exhale for 8 seconds. It's a small exercise, but many people tell me, "Doctor, it not only lowers my blood pressure but also helps me sleep better." Eighth, sleep is a free medicine that many people miss out on. When you sleep too little, your blood pressure rises higher than you think. Ask yourself, how many hours did I sleep last night? If it's less than 6 hours, it's time to reorganize. I always tell my patients, sleep enough, your heart will thank you. Ninth point, blood pressure medication is not the enemy, but the savior. Some people fear medication because they think they will become dependent. But in reality, medication is like a crutch that helps you get through difficult times. I met a 68-year-old man who resisted medication for 5 years. When he finally accepted it, he realized his health improved significantly. His memory became sharper and his mind clearer. He sighed, "I wish I had listened to the doctor sooner." And the 10th most important thing, you must monitor your blood pressure regularly. Make measuring your blood pressure every morning a habit, like brushing your teeth or washing your face. It doesn't need to be complicated, just an electronic monitor at home. Record the numbers, and gradually, you will have a clear picture of your cardiovascular health. You see, these 10 things are nothing unfamiliar. They are just small pieces, but when you put them together, they create a colorful picture, a healthier, more peaceful, and more fulfilling life. I want you to remember, high blood pressure is not a life sentence. It is just a reminder that your body needs to be loved and properly cared for. Ask yourself, what good have I done for my heart today? Am I listening to the silent signals it sends? Am I living in a way that my 60s and 70s will smile with gratitude? I share this not only as a doctor, but also as a companion on the path to health. If this video gives you a bit of inspiration, keep it as a small seed in your heart. And every day, water it with a walk, a healthy meal, a peaceful sleep. So your heart continues to beat steadily, your memories remain clear, and your journey through your 50s, 60s, and 70s is a journey worth living. Thank you for listening. See you in the next video, where we will explore more secrets to living healthy and peacefully together. If you have any questions or want to discuss further, just comment below and I will reply as soon as I can. If you find this video helpful, please give me a like and subscribe to motivate me to spread health knowledge to the community.